Okay, I'm Candace, and we're gonna be doing tracheostomy cleaning. The first thing we want to do, we want to verify the physician's order and gather our equipment in your tracheostomy kit. I will have on a gown, splash mask, and clean gloves. But first, I'm going to wash my hand and put on my clean gloves, and then I'm going to remove my sponge dressing, and you will look at it and know if there's any drainage or if it looks infectious, but we're going to say that this patient doesn't have any. And if you suspect infection, you're going to put it in a biohazard bag, but we're just going to say it's clean, so we're just going to throw it in the trash. And once you remove that, I want to hyperoxygenate my patients. I'm going to say this is my oxygen mask, and I just want to have it blowing towards my patient's trach. Okay, so I'm going to remove my clean gloves, throw them in the trash, wash my hands again, and now I'm going to go to sterile. I'm going to grab my sterile kit, and what I want to do is open it away. Okay, and I'm going to slide it over this way. And what I'm going to do first is I'm going to remove my gloves and sit them to the side. And I'm going to take my tray, grabbing it on the corners, opening it up. Okay. And the shiny side goes down. And I have that 1-inch border. Okay, so next, what I want to do is I'm going to take my supplies and fold this, and I'm going to dump it in the middle. Okay, great. Okay. How could you say that? I'm going to move this over a little and sit this here. Okay, and I'm not going to go over. I'm going to take it's not open, so I don't have to lift it, so I'm going to pour that here, saline here. Okay, and I'm not going to reach around my sterile border, and my peroxide isn't open, so I'm also going to open it, and I don't have to lift it, and I'm going to pour in this other side. And then I'm going to set these to the side, out of the way, and then I'm going to open my gloves. Move this over, and I want to put on my dominant hand first, keeping my hand up. Okay, and then I want to go in here, keeping my thumb up not to contaminate. Okay, and now, so it's not in my way, and now I can go ahead and separate my stuff. Careful with the 1-inch border. Okay. Okay. Now that I have my stuff separated, I'm going to keep my hands above my waist. Okay. And so now I want to take my non-dominant hand and I'm going to remove the inner tracheostomy. Okay. And I want to place it in my saline. And I want to let that sit for a couple of seconds. Okay, and once I let that sit, I'm going to grab my brush, take my brush, and with my non-dominant hand, I want to clean this real good with my brush. And you want to go on the inside. I'm not going to force this in here because I'm scared it's going to pull it out, but you want to go on the inside of here. And you don't want to touch your brush to your dirty hand. Okay, and you can dip it in the saline as much as you need to. And if it has a lot of secretions, you can put it in the peroxide, but just remember you have to also put it back in your normal saline to rinse it off. Okay. Stephen may have a black shirt. Yeah. Careful that your brush doesn't touch your sterile hand. You want to clean it really good. And you want to rinse it. And like I said, you can go inside of here. I'm not going to put this in here because I don't want it to pull my thing out. Okay, so now I'm going to dump this in my trash can. 2, 3, 4, 5. Okay, so I'm going to dip it in my saline. I'm going to use this to dry it off. Really good on the outside. And I'm going to throw that away. And I can use the pipe cleaner to dry off in here really good. Okay. And once I have done that, once I've dried it off, I can replace it back in here. And you will hear it, you will hear a click, but of course this is not going to click because this is my handmade. Okay. So now that I have that in there, I'm going to use my sterile Q-tip, and I'm going to dip it in the saline to clean around. I'm going to use to clean the faceplate. Okay, I'm going to discard that one, and I'm going to get another one. I want to go under here make sure I clean it real good. If you have a lot of drainage on the faceplate, you can also use your other gauze, but I don't have a lot, so I'm just gonna clean it with this. Okay, and discard that. Okay, once I do that, I want to apply my gauze dressing. Just like this. Okay. And I'm going to replace the oxygen source that's needed. And once I do that, I want to change the ties. And you want to do your ties, put your new ties on before removing the old ones, because you don't want the patient to cough and this comes out. So I'm just going to pretend, because once I move that, it's not going to do right. So I'm going to pretend that I am putting this tie on, and I'm going to ask the patient to lift her head, and I'm going to come around, and then I'm going to tie this tie to this side. And you want to make sure you can get 2 fingers underneath here and that it's not too tight. And once you have your new ties on, you can remove your old ties. Okay, and once you remove your old tie, then you can remove your gloves and wash your hands and dispose of all of your supplies that you use. And then you want to document the procedure, your observations, including trach secretions, how they look, and your patient's response to the procedure.